As you watch your little one explore the world, from those first wobbly steps to stacking colorful blocks, have you ever paused and wondered if their movements are developing just as they should be? It is natural to compare them to other children or to milestones, and sometimes a tiny question mark might pop into your mind about their coordination or agility. Identifying motor skill issues in toddlers primarily involves observing consistent delays in reaching typical developmental milestones for both gross and fine motor skills. It is not about a single stumble or a moment of hesitation, but rather a persistent pattern that stands out over time. The why behind these observations lies in understanding what motor skills encompass and their critical role in a child's development. Gross motor skills are those big movements like walking, running, jumping, and climbing, which involve the larger muscle groups. Fine motor skills, on the other hand, are smaller, more precise movements, such as grasping a toy, stacking blocks, or using a crayon. These skills are foundational because they empower a child to explore, play, learn, and gain independence, laying the groundwork for more complex physical and cognitive abilities later on. While every child develops at their own pace, and there is a typical age range for most milestones, consistent delays can sometimes signal an underlying issue. So, how can you practically observe and identify potential concerns? For gross motor skills, pay attention if your toddler is not walking independently by 18 months, struggles with running or jumping with both feet by 2 to 3 years, or frequently trips and seems clumsy compared to children of a similar age. When it comes to fine motor skills, notice if they have persistent difficulty holding small objects, stacking a few blocks, or using a spoon effectively by 2 years old. Other signs might include not attempting to scribble or draw simple shapes by 2.5 to 3 years, or struggling significantly with tasks like dressing themselves, such as pulling up pants or turning pages in a book. These consistent difficulties are often referred to as developmental red flags. Recognizing them early is incredibly powerful because it opens the door to early intervention, which can significantly improve a child's development and long-term outcomes. If you have concerns, your pediatrician is your first and best resource. They can provide guidance, assess your child's development, and, if necessary, refer you to specialists like physical or occupational therapists who can offer targeted support and strategies. Ultimately, trusting your parental instinct is key. If you notice a persistent pattern of delayed or unusual movements, seeking professional advice is always the best step. Early support can help your toddler overcome challenges, build confidence, and continue to thrive in their joyful journey of exploration and growth.